Oh, it's a good day to be a woman in this studio, I got to tell you. 10:34 in the morning, and welcome to the program, and thanks for joining us at this time. It is Tuesday, which is time for Healthcare Partners, where patients are partners, and I want to welcome. Wow, this is an intimidating group right here. I got to tell you, there's a lot of brain in here. Let's go around the room and introduce yourselves. Paul, you got the camera on the ladies. That'll be better than them looking at me. Go ahead.
Yes, I'm Vanessa Concina, the Neonatologist.
Okay.
GRMC.
Hello.
Hello.
I'm Najmeh Akhavan, and I'm one of the hospitalists, internal medicine.
Nice to meet you. Of course, we know this face.
I'm Annie Bordallo, OBGYN.
Yes, and then?
Hi, I'm Dr. Isabel Hill. I'm a pathologist.
Okay, nice to have you guys in the studio. Thanks for coming.
Thank you for having
honestly, thanks for coming, because in the middle of the day like this, it might be hard to extract you guys from the hospital and the business. Dr. Annie is on call, right? So that means she goes, do you mind if she doesn't turn off her phone? It's like, how do you tell a doctor to turn off their phone? Just in case we have to say goodbye to you first, because we've known Dr. Annie Bordallo. She grew up here. She's a native of Guam. She's a daughter of the island, and she chose to come home and has been in practice. How long have you been here?
Well, it'll be 25 years in August.
Wow, 25 years. Look at that. And you've seen it all, too.
I've seen it all. It's like it.
How many babies do you think that you have?
Well, a lot.
Do you ever count, by the way?
I do not count. I counted the first.
My producer's saying get closer to the mic.
counted the first 2 years because we actually had to turn that in for boards. But, but after that, I stopped counting.
Yeah.
It's not a critical thing in my mind to keep track of.
But I have to ask you, when you were coming back to Guam, were you at all concerned about how Guam was going to receive you? Even if you grew up here and you knew about it, your mother was in medicine as well. Were you worried at all about what people were going to say about your practice, or that you were too young, or any of that?
No, not. Again, you come home because this is where your family is, and so being comfortable here, it's where I grew up. So I didn't really. Yeah, I don't think I was that forward thinking back then. I was pretty young, so I had a job, and
that's all that counted.
That's all that counted at that point.
You weren't on your mother's couch, which made a lot of sense. It's women. Is it Women Physician Day? Is it the actual day is today, or is it tomorrow? It's on. It was, or it is. Was this past Saturday. What do you do on Women Physician Day? Do you eat a cake, or do you pat yourself on the back, or what's it like? You can each go around the room if you'd like, but personally, do you really stop and say, I'm a female physician? How cool is that?
Honestly, not really. Until people tells me, and then I just go and pat myself.
Yeah.
But otherwise, it's pretty much like a regular day, personally, for me.
Well, the struggle, I mean, there isn't, we're not seeing the struggles as we might have seen them back in the 1800s with women trying to break into the field. Having a woman physician, is there anything that makes you different than being a male physician? I guess we could start with you.
Going back to the Women's Physicians Day, I actually didn't even know we had such a day till a couple of years ago. I joined the Facebook group for women's physicians, and they posted that it was our day. I was like, hey. So I worked. No big deal. But as far as women going into medicine, it has become more popular and also easier for us to get into the field. About 30 years ago, I think a fourth of incoming medical students were females, and now a good half are female. So it's become easier. And
Are there any fields that are occupied predominantly by males that females have a harder time getting into?
I would think like the surgical fields are...
Go ahead. I'm sorry, Dr. Hill, right in there. Go ahead.
Yeah, I think the surgical fields are pretty much occupied only by males, but I think we as female physicians have advanced significantly in the last decades of becoming more active in the medical field, not only as physicians, but also getting into the administrative part of medicine that's also been occupied mostly for by men. So I think it's pretty significant that now we're in those roles too, and bringing all these different type of thinking that we women have.
Is there a difference in the motivation that made you want to become a physician? Was there any particular event, or was there something that happened to you or your family or your mother or something that sort of was the light bulb that said I want to be a doctor?
In my case, I think I was kind of influenced by my family, because I'm pretty much the first physician in the family. So it was not like it was their sole desire for me to be a physician, but it's kind of like they helped me develop that desire to become a physician.
Okay. How about you, Doctor?
I'm also the first physician in my family on both sides, but I was actually more encouraged to go into engineering, because most everybody was in engineering. And I liked science and biology and the fields, and I didn't really have any role models, so I just started working in the hospital as a nurse aide to get a feel for what it's like to be in the hospital, and chose that instead. So,
well, Annie, medicine was in your family anyway. Your mother, exposed you to the field of work. But to become a doctor as opposed to being a nurse, was there something that made you want to do that?
Well, I think that's when I was younger and going to the hospital all the time and worked as a student as a nurse's aide, and certainly saw all the nurses and the interactions between nurses and doctors who were predominantly male. I think we had 2 female physicians at the time, with probably 50 male physicians. And I told my mom, I don't want to be a nurse. So, I wanted to be the doctor. So, so I think that certainly, and I guess at that time, I'm a Title, 9 baby. So really, I really benefited from the 70s. Again, these women here are a little bit younger, so they had that extra 10 years of other women going before them, and I'm a child of the 60s and 70s, so I still was beyond that. I didn't question that women could be whatever they wanted. I mean, the women before me, they kind of paved the way.
Especially your mother. I mean, having come out of the war, there was a whole nother attitude of her parents coming out of the war.
Well, again, traditionally, that was, the barriers were more traditional. And again, I talk to my pregnant patients all the time that pregnant women in the workforce was not really allowed before. And when women get pregnant and they're like, I need to stop working, and it's like, okay, do you know how many women before you fought to not be fired or not have to go home for 9 months? They don't have that experience, but they don't realize what a battle that was to get, to be able to keep their jobs. And so, and it's because the view of pregnancy was it's a disease and you have to go home and lay on the couch. And, and again,
sometimes I wish that they still felt that way.
Well, the women now who haven't ever had to fight for that, right, are now on the, hey, they had a good, maybe that was a good thing.
What you got to stay home in bed for like 2 weeks and never get out of there? Those are the,
So things do, what goes around does come around sometimes, but I think overall, the women in the workforce and certainly in medical school now, I think we've crossed the halfway mark. I think there are more women now in medical school than men. Yeah. So, and I think, again, women bring a unique perspective, and I think we're learning more and more about that in every career now. Every day in the paper, there's a women's issue that comes up that affects the way that we think about life, and it seems disruptive because nobody ever addressed it in that perspective, but it's not disruptive because more than half the population is female. So we don't look at it as disruptive, but I think in the media and the way these things get played out, it seems very disruptive, and that's just because it's been a male-dominated world for a long time.
But in the cultures, though, and maybe we could discuss that, in the cultures, it must be much different in your culture as opposed to somebody else's culture, where women were in charge of the house and they were whatever they laid out was what was rule and what was how it was guided.
I'm originally from Colombia, but I never doubted that I could become whatever I wanted it. Like, as Dr. Bordallo was saying, that fight was already happened. And at the time, my parents were very encouraging, like, you are going to school. Oh. It's not an option. You are going to school, and that's going to happen, and you can be whatever profession you want and whatever you pick. And that was never a doubt. So we are lucky, this generation, that it was never even a question in my mind that I could not do something that I wanted. It's never been. And any area of my career that I want to go, I'm sure I can get there if I work for it. And it doesn't really matter I'm a female. I think that's an advantage now, that I can offer so many other things, like the multitasking. Like, females, we're known to multitask better and have some other opinions and things. So it's definitely we are taking advantage of all that fight that happened years ago. Yeah.
Dr. Akhavan, you want to address that one? We're talking about the different cultures, how you are catapulted by your parents, or by dictated what your family business is.
I'm from Iran, and Iran is known to have more restrictions for women in workforce and everyday life.
Socially,
socially. But actually 60 to 70% of women going to college in Iran are female. 60 to 70% of college kids in Iran are females. So it is encouraged, especially by all the mothers. They really, even if you end up not working in the field, they encourage you to get the education. And in medicine, more than half are female physicians. So it was encouraged to me both by family and in school. And I was never told I can't do something or whatnot based on my gender.
Were there financial considerations as well when you were going to school? Were there more opportunities for your school to be funded, or for you to get grants or scholarships? Were there more of these things available for women, or did you have to go out and seek financial help from not necessarily from the government, but from personal finances, from your parents?
I didn't feel a difference for guys versus girls going to school. And then throughout medical school, I lived on loans and borrowed a lot of money to get through it. So I think everybody was struggling equally. It's very seldom that families can afford to pay for the whole cost of medical school. So most people end up getting loans regardless of their background.
You had to seek some kind of assistance. That was the way. So what about when you are seeing a patient for the first time and you come through the door and you're a female? Maybe not so much for you, Annie, because are women more comfortable? Yeah. Are women? I mean, I guess that's a good question. Are women more comfortable with a female OB?
I would think so, but again, if
you've never noticed a difference.
Well, again, it's what people are used to. Mm-hmm. So I think here, probably 25 years ago, when I started practicing, I think women were quite comfortable with male physicians because they didn't really have a choice, and so it's not so much a comfort level as much as this is the doctor. So, and I think really culturally, when the doctor was American or Caucasian, patients felt more comfortable with that than the local physicians or the Filipino physicians. And so I don't know if that was just a social, education kind of an issue, but for sure I think that there was some distinction between those classes of people. But I think over time, as there have been more females in the hospital, people now, I think, try to gravitate towards, and again, we do a lot of things other than deliver babies, so, the personal conversations and what people talk about in our offices, I think a lot of times patients think females can relate to it more. So that's my impression. But again, my personal experience is, if I want to go and talk about these things, I probably feel more comfortable talking to a woman than a man. But
in your field, what about in the rest of you? Do you ever have a gasp from a female or a male patient that says, I thought you'd be a man, or any of that?
I think in my field, like especially in pediatrics and neonatology, since it's more of like little, kids, dealing with kids. So I feel like parents feel a little bit more at ease dealing with a woman doctor, just because of,
the nature of the job.
The nature of the job. But it doesn't mean that, men that is in my field cannot do it the same way. It's just that naturally...
Do you think there's a level of compassion? You think that there's, that's the unwritten word there, or the emotion?
There is that, what do you call this, a perception that women doctor has that
maternal,
more compassionate approach to kids as compared to male. But that doesn't mean that, there's really that difference. But there is just that perception.
Okay. Dr. Akhavan?
Not so much. I'm an internist, of course, and so my patients are about half and half. I don't feel that much of a difference in how I'm trusted by patients. There's been times where I walk in and I'm wearing my white coat and stethoscope, and they know I'm the physician, or and they're on the phone, the patient's on the phone, and they tell their family member, "Oh, my nurse just walked in, I gotta go," So there's that sometimes, but I've never been treated that I've noticed based on my gender. I have felt difference in treatment based on my nationality and background and race, and that I felt, where we've had patients where there was a group of us during training of 4 or 5 doctors, and we were all foreigners, but the patient didn't want to see any of us, and only picked the Caucasian one, and actually found out she's Polish. So he was kind of stuck. But other than that, no, not really. And sometimes maybe nurses, they're just used to working with male doctors and getting orders from them, so they're more receptive to them and responsive to them, but not really. I mean, I think once they know you,
to know you is to love you. Dr. Hill, do you ever feel like that?
Well, I don't really see patients. I mostly talk with the clinicians. Like, they send me samples and I have to look at them in the microscope. So I don't really see patients face to face. But I will say, like, when I interact with the other physicians, I feel that they feel comfortable talking to me regardless of my gender. And I think that actually they may feel more comfortable coming to me and saying their whatever problems they're having with the lab or with samples or things like that. And so I've never feel that being a female has been a negative impact in my career or in my life at all.
What about outside of the hospital, outside of your field, when you are in maybe research or in organizations where doctors in communities gather and they start these different associations, and are they run predominantly or organized predominantly by males? Is that just because the numbers of doctors might be male as opposed to female?
I was in a research laboratory for experimental pathology in Harvard, and they were all female. So I have no examples at all for you. They were all female.
Your path was just paved.
I know, right? The director was a female. All the PhD were females, and I think there was one fellow that was a male, but everybody was female. They were strong scientists and respected researchers with publications, and they were very
It sounds to me like that being a female in this field, in the field of medicine, is not a big deal, and no one should be really surprised about it. It's like female broadcasters, like, I mean, we're a dime a dozen. It doesn't, there's no way that was paved that, of gold for me because I was a female. There were some tough fights along the way, granted. But once you've achieved that and you've made a name or you're a success, then you don't worry so much about what people care if you've got, boobs or not. It doesn't matter. It really doesn't matter. Do you ever feel when you were going to medical school, did you have any problems there? Were there challenges along with the fellow students, colleagues? Was there any gender discrimination there, or anybody who thought you couldn't live up to the task?
I'm the oldest, I think, of this group. So, and again, even I went to school at Howard, which was predominantly an African American school. So it was minority and again, but it was a pretty matriarchal kind of culture. So there were quite a few women, and I would guess it was just a little bit less than half that were female. So, and that was 30 years ago. But, I think in terms of my training, when it wasn't so much my colleagues, because, there were one or two women in my cohort training program. I went to a very small hospital training program, but the attendings were mostly male. There might have been one female physician, and the way people talk about women at that time is when they talk about the men in terms of their skill sets and who's good and who's bad, but they talked about the female physicians in terms of personality, who's this or that, or
who's cuter,
it was
an
emotional or. So I think that is something that I think has changed over the years, but still, there's still a lot of remnants of that. And again, I think it's nice when you come up in a younger age group and you don't even think about it. Isabel doesn't have any, it is what it is, but I think, and it depends, I think in the fields, it depends on what community you're talking about. So yes, when you walk in and predominantly the administration or the bosses and at GRMC we have a female CEO, so it's again not kind of the same thing, but there still are remnants of that. But fortunately, the people who are running those are also my age as well, so it's getting less and less, and I think that's the advancement. And I think we do recognize that women have opinions that even though we've classified them as emotional, they're valuable. And that's the unique perspective, I think, that women bring to the table. And I think some of these older institutions that were having difficulty sort of not so much getting through, but again, getting women elected. Things like that where... And it's not because they're women or men, it's just we have more women candidates now, so we have more choices, whereas we didn't have any choice 10 years ago. Women were too busy to run for office. They have other things going on.
That's interesting, being paired up among people well, speaking personally in my field, it's whether you're hot enough. You know what I mean? It's like, oh, she's hot, but the fact that she's a doctor makes it even hotter. You know what I mean? Do you ever get that? You ever get suitors coming after you because they're trying to cash in? I'm sure you get a lot of that. Okay. Well, you all look like you're wearing wedding rings. I mean, you're already partnered up, but I'm sure that when Annie was talking about how women were looked at in certain venues as their personalities dominating what their skill set was. Did you have any of that? Was that also, a byproduct? Maybe you didn't pay much attention to it, because I think that women do tend to, when somebody's trying to hit on them, in the workplace, you tend to ignore it more than you do try to stop it. But did you ever get that? I'm looking right at you because, you've got the whole package going on, and you've been around the world, and I think that your resume shows that you've...
that. Thank you.
Not that you other girls are not hot. It's not even about that. But you know what I mean? If you were a good-looking doctor, I would say the same thing. A male doctor, I'd say the same thing.
I think pretty much all females probably experience that, and some of it could be just how you put yourself out there, whether I'm getting older or that I'm showing more confident and looking more tough to the men, that I'm not being approached like that as much. But that has in the past, and usually by male colleague physicians that felt like they could make here and there inappropriate comments, but again, I've never been one to freak out over a comment. and I try to, show my own professionalism and.
Did you guys ever have any sexual discrimination in the workplace? Was there? You've always been your kind of boss, though, Annie, right? You have your own clinic, so you are in charge. So you want to come after her, you need to come strong. But did you ever feel that? Did you ever have any advances made toward you?
All the time, I do feel like not like it's like they are too emotional in a negative way or. It's just work. I did have colleagues saying, like, is that working with females? It's so much difficult. I remember there was a locum pathologist that was working at the other hospital, and he came to visit, and he came and saying, like, yeah, I'm working at this other lab, but the boss is a female, and it's so hard to work for females. I was like,
yeah,
really, you're saying that?
Or the other one is she's on the rag. Watch out, she's on the rag.
Yeah,
those kind of comments.
Yeah, those kind of comments, like people like demeaning the female boss. But you do hear that a lot.
Yeah,
I have heard. Yeah.
Well, I know that it's no big deal for you because you're in it, you're doing it, and you're successful at it. But for those of us, who have female doctors or who seek out female doctors as their primary physician, happy Women Physician Day, belated. Well done, well done in making your mark, and well done to folks like Annie who've come and paved the way for life to be a little more easier. Thanks a lot for everyone. I appreciate your time. That was it. Healthcare Partners, where patients are partners, brought to you by Guam Regional Medical City.